I'm Dr. Deuk with the Deuk Spine Institute, and we're here for a spine scans session. Back pain is not a death sentence, yet there are many countries that are jumping on the bandwagon of treating patients with chronic conditions like back pain and neck pain as though they should be having a death sentence. In Canada, for example, you can now die with dignity. They have an entire website and program that is set up for people with chronic medical conditions where the patients don't want to live and suffer anymore in pain, can actually ask doctors and nurses to help them die. Now, what's the problem with that? There's nothing wrong with that program if you have cancer and there is no cure and you're terminal and you're going to be dying in the next 3 to 6 months. And cancer is a horrible disease that it doesn't just kill you at the end of 3 or 6 months, but you suffer the entire time. So it's understandable that a solution like this would exist for something like cancer. But what about back and neck pain? Deuk Spine Institute has figured out that there are 30 things that are specifically responsible for back pain, and we can now cure 99% of back pain. Yet if you live in Canada, you will not get a cure, you will suffer, and you will qualify, according to the government in Canada, for assisted dying. Now, to see if you're a candidate for assisted dying, all you have to do is go see a doctor or nurse who tells you, sorry, we can't cure back or neck pain that you have, so you can die, and we'll help you do that. If you look at this form here behind me, this is available to people living in Canada, and by the way, they have to have insurance according to the form. And really what this is this is a way for the government of Canada and the insurance companies to basically stop paying for your medical care when you have back pain or neck pain. They don't want to spend the money on you. Instead, they want you to kill yourself so that they don't have to pay any money to the doctors or practitioners who treat back and neck pain. That's what this form is all about. You have to have, according to the requirements, a person is considered having a grievous or irremediable medical condition when they have a serious and incurable illness, disease, or disability. Lower back pain qualifies for that for most doctors and most patients because they cannot get a cure elsewhere, so they're told they have a chronic condition that is not fixable. They have to be in an advanced state of irreversible decline in capacity. Most people living with back and neck pain, they get to a point where basically they can't do anything they want to do. They have to quit their jobs, they have to quit their hobbies, they have to change the way they live life and really take it easy. So that's the state of decline they're talking about. And they have to endure physical and psychological suffering, which people with chronic back and neck pain do, and that's due to the illness or disability that is intolerable to the person. Let me spell this out for you. If you have chronic back pain or neck pain in Canada and some of the other countries as well that are jumping on board, like Australia and Spain and Austria and New Zealand, and there will be more folks in the future who will treat people with back and neck pain the same way. If you have back or neck pain, this reminds me of a movie I watched as a kid back in the 70s called Logan's Run, where the government decided that, well, if you live past 30, you start to develop diseases and you become an expense to society. And they didn't want to pay for your medical conditions after the age of 30, so they created this thing called carousel, where you basically disappeared from society at the age of 30 on your 30th birthday and never to be seen again. And of course, what they really did was they killed those people so that they wouldn't have anybody over the age of 30 with these chronic diseases that they'd have to pay for. Well, this is the same thing happening right now. It's no joke. Movies were made about it in the past as a, wow, can you imagine a society where they actually kill people with diseases? That's what's happening. Now, if you live in the United States of America, like I do, then you might think, well, this would never happen in America. We don't allow those kind of things to happen. It's happening, folks. If you live in the state of California, you can actually ask for end-of-life assistance from the state of California. It's called End-of-Life Option Act, and it's law. So if you have a terminal condition like cancer and you have less than 6 months to live, you can actually ask the government to help you kill yourself. Now, I can understand with certain types of cancer where they're incurable today that would be reasonable. However, it creates what's called a slippery slope. And what that means is it's an opening of the door, which will then be opened wider. So today it's cancer in California, but maybe next year they're going to pass laws that allow people with back and neck pain to be killed as well. Folks, I got news for you. Deuk Spine Institute has discovered the cure to back and neck pain. All you have to do is come here. We offer a free MRI review. Do it from the comfort of your own home. Fill out our form on our website. Send us your MRI.com images. I'll review them personally with you. And through a Zoom call within 10 minutes, I'll tell you exactly what's causing your back pain and, more importantly, exactly how we can fix it with one of our minimally invasive proprietary techniques. We've been performing these minimally invasive surgeries for 20 years. Our success rate is 99.6%, curing of back pain from herniated discs, bulging discs, spinal stenosis, and any other condition involving the back or neck. Folks, you owe it to yourself. You owe it to the people who love you and care about you. Check out Deuk Spine Institute, do the free MRI review, avoid these horrible programs of assisted dying just because you have a condition that most people will tell you that's terminal, but it's not. Come to Deuk Spine. Thank you.